age 65 and still working and still have employer health insurance, but trying to decide whether to go on Medicare or not? Well, here to talk with me about that is Jae Oh, author of Maximize Your Medicare. Jae, welcome.
Thanks for having me, Bob.
A pleasure. So many people who are working past age 65 who have health insurance through their employer or through their spouse's employer are probably wondering, should I stay with this plan or should I go on Medicare? What advice do you have for folks?
It is by far the most popular and yet confusing question that I've received over the decade that Maximize Your Medicare has been out and all of the revisions. And especially with full retirement age now, firmly entrenched beyond 65, I don't think that that is going to stop. So if you are the full-time employee and covered by your employer-sponsored plan, you can delay. Maybe you want to have a number of reasons for doing so. Of course, cost is one, where the employer, for example, contributes a substantial amount of your overall health insurance premiums. That said, the complications begin the moment a single variable changes. For example, if you're married, there's the challenge of covering your spouse, especially if that spouse is not yet Medicare eligible. There are other questions as well. For example, the reality is that Medicare coverage as a contract, meaning that, for example, Medicare plus Medigap or Medicare plus Medicare Advantage, that the coverage, the overall cost, if you are a substantial user of healthcare services, that in fact, the out-of-pocket maximum, for example, under Medicare Advantage plans, can be notably lower than your employer-sponsored plan. So as you can hear, that there are so many moving parts here that there's what you can do, which is you can delay. Let's be very clear, meaning that you can delay if you are the full-time employee and covered by your health insurance from the employer. But the moment that that specific sentence is untrue, then a number of different considerations have to be kept in mind. Very complicated and almost impossible to really ask your friend, your neighbor, your brother what to do, because the reality is that incomes, situations all change. Employer-sponsored plans are different across the board, meaning one size definitely doesn't fit all.
So, Jae, in addition to cost, do folks need to think about the provider network, pharmacy, prescription benefits, et cetera? Is that among the things that someone might look at when evaluating whether to stay or go?
Absolutely, Bob. You pointed out correctly, which is that when you're part of an employer-sponsored plan, that even if you are very satisfied, you're ultimately part of a network, meaning that whether you have a PPO or an HMO or the different types of plans, whether that be locally based or nationally based, you will be subject to some type of network restrictions or limitations. Under original Medicare, of course, if you will, the network, in air quotes, is far broader, meaning that the number of providers that accept original Medicare is far greater on an overall basis. Now, if you selected Medicare Advantage, then, of course, a full reexamination of the networks, the acceptance of your particular Medicare Advantage plan would have to be custom fit to be able to make sure that you can see the healthcare providers that you prefer.
So, Jay, we've covered a lot of ground. Anything we missed or anything that bears reemphasizing?
Well, I think that the number of moving parts here, Bob, is so broad that a single change to anything that we've mentioned here. We've not even discussed in full, for example, if you're a high income earner, that you may be subject to Medicare IRMA, in which case the math of money considerations would again be reshuffled. So it goes to show you that while people think that, okay, well, I'm just going to apply for Medicare or not apply for Medicare, even if you're working, that there can be additional things to think about, which can affect your access to healthcare services and your overall cost, both.
So it sounds like this is one of those cases where getting the help of a qualified, competent professional could be well worth the time and money spent.
For sure, Bob. I mean, the reality is that if there are not very complicated financial planning implications, that the simple steps here, meaning the filling of forms and administration of, how to proceed, that is done without cost here, for example, at GH2 Benefits and at many others. We will not be the only one. That said, there can be other financial planning considerations which go, as I said, for example, there's the Affordable Care Act's APTC, Advanced Premium Tax Credit, as well as Medicare IRMA, all into a very complicated combination from both a financial and a healthcare access perspective.